it's exploding and all that. Well, who are the people in the population that are most likely to get sick? Are the elderly, and that's people on Medicare, or people who are disabled. Those are people on Medicare. So and then who's the other group of people that are most likely to get sick? Are the poor, and that's Medicaid. So you see how the private health insurance industry is really cherry-picked here. They're more likely to get the healthy population, and they dump it onto the government.
Of course, because they can refuse to take anybody else, though, and often do. You know, if you're going to get sick and you're already sick, forget it. We're not going to insure you.
Right. So, and then if you get sick, let's say you're so sick that you can't work anymore, you may lose your job or lose your insurance, and then you fall onto the government, and then people say, see, the government health care costs are high, they can't control health care. Well, here the private health insurance industry is driving people into the government run. You know, we need to provide basic health care to everybody. I think we could, we're not going to prevent every single illness, every single tragedy, but you know, I think we could reduce it, cut it down by a third or half. Even people who are elderly, if you're in good health, the costs are minimal or low. It's when you have a stroke or have a heart failure, a heart attack, or
that last 10 days of your life, 50% of all the money you spend in your life is spent then for health care.
And health care, yes.
And so I think, you know, we provide, we have a poor primary care, basic health care system in this country, and it does drive our costs much higher.
Well, caller,
well,
does that answer you?
Yes, but could I say one more thing?
Sure.
Being as it's this time of year, and hopefully we can think some cheerful thoughts as well as other type thoughts, and also try to help our fellow man that may not have as much. As there's food banks that need donations, all kinds of things. But I would like to take this opportunity to mention that in Westfield, there's going to be a wonderful holiday thing coming up this next weekend. The dance studio is giving a Christmas thing, and every year they give one, and they're really, really well worth the ticket to go and watch the young dancers and so forth dance under Mrs. Bishop's auspice, and I think you would really enjoy it. So check into getting tickets to the to Mr. and Mrs. Bishop's Dance Studio
Thank you, caller.
Christmas program.
Good. All right?
Okay.
Enough said.
All righty. And Merry Christmas, Happy Holidays to everybody there.
Well,
the weather is wonderful, the sun is shining, and I'm feeling good.
Terrific.
Okay, thank you.
Another happy senior.
All right.
One of the problems of Medicaid is a so-called safety net. And more people are going onto that safety net, especially in New York State, where we have the Cadillac of services, theoretically. But in New York State, they did a funny thing. That's one of the 2 states, I believe, that actually makes the local people pay a huge chunk of the Medicaid. Now, most states split it 50-50 with the Fed. But New York said, well, we'll split it 25-50 with the Fed, and you guys over in Chautauqua County, the poorest county in the state, with the hugest number of people because of the poverty, and the seniors, we have the greatest number of seniors, you pay 25% of all the costs. Well, when you break that up in a county that doesn't have a lot of dough, you got skyrocketing costs, and we have real problems here. I've got a phone caller who wants to address that. You want to wait a minute here, or can I continue this thought? I'm ready to roll here. Well, good morning, caller. Thank you for waiting.
Well, good morning, Rudy.
Hi.
Is health care going to cover everyone in the next decade? They sure are not in a hurry.
What do you think about that? Do you think we'll get it in a decade, in the next 10 years?
Yeah, I hope so. If we don't, the costs, we're not going to get our costs under control until we provide basic health care to everybody. And
well, that's what, as I started to say, and that's one of the problems we have in Chautauqua County is our budget's going wacko. Well, the state said, well, we'll set limits, but even so, we're still rising rapidly, right?
Well, yeah, I'm tried to work on this issue at the county level.
Yeah.
Again, you're right. We are one of the few states that pays for Medicaid through a local share, and that's why if you look at your county property tax bill, you're going to see on there that Medicaid's around 50%. And we had an opportunity a couple years ago to do a swap where we would give that responsibility back to the state, but we would have had to give up a portion of our sales tax. We missed that opportunity. I think it was a significant opportunity lost there. And it really is going to end up costing taxpayers in this county millions more because we didn't do that swap at that time. But I did get legislation through the county this year to try to work out something with the state where we would get another chance at that. And that's something that Assemblyman Parment, myself, and others are going to start working on in January.
Good.
What that will do, I think one reason why Medicaid costs, why this quote Cadillac plan is the state could provide that kind of coverage and it wasn't as painful for them to make that decision because they knew that the local was picking up a significant share. Now it's not 25%, it's down around 17 to 18%, but still it's a tremendous hurt. In this county, Medicaid spending, total Medicaid costs went up 20 million in 1 year. It's now 220 million for just the people in this county.
So it's a lot though.
The other reason why, so it's going to make the state more accountable if we push that back on them. Now it's going to make us more accountable because now what we did in the past was we would just raise sales tax. If instead of reining in our county government costs, all we had to do was just raise sales tax, blame it on the state. We say, well, it's the state's fault that it's all those unfunded mandates. That's why our and then we would just raise sales tax. Well, we have all these different towns and villages and all these different layers of local government with tremendous costs. And so if we give up our sales tax, give it back to the state, it's going to force us to become more efficient as a local government. Do we really need all these different layers of local government?
Yeah, there you go.
And there's significant savings there. The comptroller and the Attorney General Cuomo came out with studies showing that the average savings, total savings taxes are between 5 and 20%. So let's say 10%. If you could get a 10% reduction in our total county taxes by consolidating government services, I mean that's huge.
Of course, half of the cost is something the other states don't have, most of them, and that's
right.
The Medicaid. I mean, a Medicaid, which is it's horrendous. I wanted to, and incidentally, one of the callers just mentioned to me, he said, this is an aside, but it has to do with medical now. Did you realize that over 50% of the Japanese optometrists have cataracts? The rest of them drive Rincons. Thank you, caller.
Okay. Well, thank you very much.
Okay. You're welcome. We're with Rudy Mueller. Rudy Mueller is a legislator, a doctor, physician. I should call you Dr. Mueller, right? But Rudy, you go fine with that.
Yeah, sounds good.
And I think he's got some common sense ideas here in terms of reforming our health care. We don't know that this is going to happen because I don't know, everybody involved seems, all the lawmakers seem to be making a huge amount of money to keep it as it is, the status quo. And you had something you wanted to bring up there, Rudy? Just mention it.
I think, you hear all these different things on TV and on talk radio and everything. I would suggest that people go to Congressman Higgins' website. It's easy to do a Google on that. And then you'll see the Affordable Health Care for America Act. It's on his website. It's off to the right. Click on that. There's a lot of information in there. It's easy to read. I have right here the 4-page short summary. There's a 10-page summary. Obviously, it's a 2,000-page bill. You're not going to be able to read everything in there, but the 2,000-page bill is on the not on his website, but you can get to it. It'll probably take up all the memory in your computer, but you can read the summaries, get a lot of answers to your questions. There are good things in this bill. that I'd like to mention just